Matthew Show from the Citizens Bank studio. I really enjoy visiting with James Skermetta. I really encourage you to go look him up on Facebook, on YouTube. His channel is terrific. Listen, I want to tell you, I'm thrilled to continue these conversations with Singing River Health Talk. So far, we've talked about colon health. We've talked about health in women's world and how to avoid some serious issues along the way and how to be extremely preventative in the way you approach yourself and your own health. And we've talked about pain management. We did that last week, and that was a terrific conversation. In fact, it was originally scheduled to be a half-hour conversation because of a problem with one of the guests we had. We were able to take that for an hour, and it was a great conversation because people are focused on managing pain today. And in the world of opioids, that's not where they want to go. They want to manage in different ways. And we had a long, terrific conversation about that. Today, we're going to talk about, urology and health in that respect. And listen, I'm a 67-year-old male. For regular listeners, you know this. I work really, really hard to take care of myself, running, weights, the whole 9 yards for over 40 years. And I watch my numbers. PSA, for example, extremely important. Have had a couple of brother-in-laws who have had cancer. A really good friend of mine that had a very high PSA, had issues surrounding that. And he did not have cancer, but he still had to have major surgery. So I watch it closely. It's something you have to do, but that's not the only thing you need to look for. But that's what we're going to talk about today. And so without any further ado, I want to bring in Dr. William Hughes. He's a board-certified urologist. He performs surgical procedures at Singing River Gulfport, but he's also part of the Urology Associates in Gulfport. And he's got a terrific background, which I look forward to telling you about. So without any further ado, Dr. Hughes, I appreciate you joining me today.
Oh, thank you, Ricky. I'm happy to be here, and I'm happy to talk about men's health and tell you some of the exciting new things we're doing here in Gulfport with Urology Associates and with Singing River. I think it's a really blossoming time for urology here.
Well, look, you know what's interesting, as I mentioned at the very beginning of the show, one of the things that in conversations with your administrator and other hospital administrators, one of the things that we're learning is in order to stay relevant, in order to be literally on the edge of the best possible patient care, is technology is playing a tremendous role. And when I look back at your, the work that you did, your preparation, the things that you're doing today, technology is a huge part of that, isn't it?
It is, absolutely. I think it's twofold in medicine. It's maintaining your knowledge base because, of course, every year our knowledge base grows, and that's why physicians undergo recertifications at certain intervals. But it's also adapting to newer technologies. Look, there's a lot of old urologists in this country, and there's a lot of urologists that never trained in robotic surgery. Those surgeons do incredible surgeries. They do them through slightly larger incisions. They have very comparable outcomes in terms of cancer control and postoperative complications. But the value of being more recently trained is just being more exposed to the most recent technological advances. And they allow us, hopefully, to gain, minor or major improvements in long-term outcomes for patients, side effect profiles, and just being able to offer patients a variety of treatment options.
Yeah, I mean, it's a lot of focus these days on less evasive surgeries so that people won't have the long recovery periods that used to be there. And in some cases, maybe still are there. And that's, it's been a kind of a steady part of the conversation with all the folks that I've been talking to at Singing River Health System. Listen, you went to the University of Georgia, and you also went to University of Georgia Medical School. You actually ultimately came back to Tulane. But are you from Georgia originally?
Yes, sir. I grew up in Georgia. I did all my education there prior to residency training. Tulane residency training was 5 years long. I love New Orleans. I didn't want to leave. I think everybody who lives in New Orleans probably regrets leaving to some degree, but the value of Gulfport is it's an hour and 10 minutes away. So we've got French Quarter Fest coming up this weekend. I'm hoping to make an appearance.
Yeah, listen, I was a former publisher of the Times-Picayune and president of Nolan Media Group. I know that area extremely well. Lived in the Warehouse District. Loved that place, like you can't imagine. And we're part of the Gulf region. We're an extension of New Orleans. That's why after Hurricane Katrina, it was so important for them to recover, because we wouldn't recover until they recovered. We had to recover together. And it's an important story about the symbiotic relationship we have. The culture there is undeniable, and that's the thing that connects you. That's for sure. Great experience. So, hey, by the way, what part of Georgia did you grow up in?
I grew up in Peachtree City, Georgia. It's a suburb of the Atlanta metro area, southwest of Atlanta.
Yeah, well, that's cool. When I was publisher of the newspaper here, I had responsibilities for the newspapers in Macon and Columbus, Georgia. So I spent a lot of time in that part of the country, and you love it there. Love being there, and love the people there. What's interesting about your undergraduate degree, you actually got an undergraduate degree in genetics and biology. How often do you pull on that?
Occasionally, it's to some degree, college education for physicians is a means to an end to get to the medical degree. But, we do a lot of advanced prostate cancer management now, and there's definitely a role for genetic testing and, genetic counseling and helping patients understand, what their family members' risks are of developing diseases that they've experienced. So definitely it has added some value.
You know what I've noticed? I've had in doing this show, I've been doing this show for 5 years. I retired back in 2016. I'm doing this show, and what I've noticed over 1,400 conversations that I've had is that the role AI plays, it becomes more a part of the conversation. And it's never been more true than in your world, has it?
No, I think there's truth in that. AI is an interesting subject. I think we're hearing a lot more about it lately. And it's being implemented or at least tested in some fields of medicine. So you think about, some of the fields of medicine that AI plays well to. I think about pathology, radiology, right? You've got physicians whose job is to review images of patients' bodies, to review slides, section slides from patients' bodies. And, they're testing to see if artificial intelligence programs can accurately identify and diagnose treatments or diagnose problems, diagnose cancers. Can they differentiate squamous cell and, urothelial carcinoma? And, I think that we're heading in that way. Now, can this all be done without any supervision? I don't know if that will ever be the case, but I think that every physician probably is looking over their shoulder a little bit, wondering how AI is coming for them. I will tell you right now, I think the best value for AI in medicine is with artificial intelligence scribing. So if I can stand in a patient's room and talk to them for 10 minutes about their problem, and my phone can record the conversation and generate a note that I can review, I can spend more time talking to that patient, answering their questions, than if I have to go manually type up that note or hire somebody to come and listen to the conversation and type the note. So I do think AI will add value to medicine. And I think overall surgeons are probably more protected than anybody, just because anatomical variation is so great. It's hard for me to imagine a robot being able to perform a surgeon's job, but you never know. We'll see what happens in 15 to 20 years.
I spent a lot of time over the past year studying AI, using it a lot. And the way you talked about using it, I think is literally going to happen. And what it will also do is probably give you some prompts back to say, did you think about exploring this? I mean, it could be a teaching tool as well to kind of keep you on your, it will literally come back and say, doctor, why didn't you ask this question? Or maybe you should explore this. Or it's just I see it as a tool that doctors can use to be more thorough, to take less of a leap of faith, to really zero in on what we know and have that knowledge base available to you. I think it's going to be terrific, but you're still going to have the doctor there. There's no doubt about that in my view. Hey, listen, you have a very unique distinction, actually. You did aqua ablation therapy, the first in Mississippi for that matter. What is that?
Yeah, so aquablation is a newer surgical procedure done in the operating room for men with enlarged prostates. It's not a treatment for prostate cancer, although I will be happy to kind of dig a little bit into the differences between those two. Some patients have enlarged prostate and prostate cancer, but it is one of the newest and, in my opinion, most exciting treatments available for men with enlarged prostates, because it is very versatile and it is able to preserve sexual function for men in a way that many other procedures are not. And so when we think about treating any medical condition, obviously the things that patients always are curious or want to understand is what are the risks. And I think when you talk about risk, you have to consider that there are always risks in life. There are risks to doing nothing, right? There are risks to taking medications for 15 to 20 years. You said you're 67 years old, I believe. I wouldn't be surprised if you've taken an alpha blocker medication like Flomax. Many men your age have, and if you haven't, I'm sure your friends have.
I'm lucky. I'm lucky. Yeah.
Yeah. So the point is, when we talk about, BPH and large prostate, which I'm sure we'll dig a little bit more into, there are risks on every side. There are risks with doing nothing. There are risks with long-term medications. There's risks with surgery. And I find the surgical risks tend to just be a little bit more acutely presentable.
Well, we'll pick it up right there when we get back on the other side as we continue our conversation. This is Singing River Health Talk, and we're visiting with Dr. William Hughes today. We'll see you after this break. Welcome back to Ricky Matthews Show, and we're having a conversation today. It's Singing River Health Talk, sponsored by Singing River Health System, and Dr. William Hughes with Urology Associates. And, we were talking during the break, while he may see a woman from time to time, the majority of his practice is centered around the kind of issues that men might have. And, let's just kind of talk about this a bit. I mean, it's a common issue. You and I were chatting during the break that statistics basically say that the older you get as a male, the more probable you're going to have some prostate issues. And you've built a practice around that. So tell us a little bit more about that.
I would be happy to. We're going to start basics, okay? The prostate is a sexual organ that exists only in men. It sits at the neck of the bladder. I like to think of it as the gateway out for urine on the way out of the bladder. And so as men age, their prostates tend to enlarge, and the larger they get, the more obstruction they cause. The early symptoms men experience are a weaker difficulty starting. Maybe the stream starts and stops. Maybe they're having to push or to strain to get the urine out. We think about two types of urinary symptoms. There are obstructive symptoms, as I just described, irritative symptoms, frequency, urgency, getting up a lot at night to pee. I can't hold it. When I go, I got to go right now. I'm afraid I might leak if I don't go. And men that have enlarged prostate follow a fairly predictable pattern of symptoms. So slowing urinary stream in the beginning, difficulty urinating, eventually developing the frequency and the urgency. Now, Ricky, you are obviously a health nut and you take good care of yourself, but I'll tell you that there are a lot of men out there that don't really come to see a urologist or a doctor about their urinary symptoms until they are leaking on themselves or having a lot of major issues. So, we like to intervene early. The bladder health is important. The bladder health to some degree depends on prostate health. And when we talk about treating enlarged prostate, in my mind, what we're really doing is working to preserve normal bladder function for the rest of a patient's life.
Yeah. So it's, and it can be debilitating. And your goal is to give people hope and happiness. And it can be very unhappy when guys are having some difficulties. And you've built an entire system around how to go about giving them their happiness and their hope with as less evasive a surgery as you possibly can. But isn't one of the keys, you got to have those annual PSAs. You got to stay on top of it.
Absolutely.
You can't assume it's not going to be a problem.
Yes, a PSA is a once a year blood test, maybe once every 2 years with your urologist, with an occasional rectal exam if they feel it's appropriate. But what we're really doing there is we are trying to catch prostate cancer early. PSA is not a specific marker for cancer, but it tends to raise our alarm. And, PSA is unique. Prostate cancer is unique. There are not a lot of cancers that we can routinely test for with a simple blood test to catch it early. It has changed the way that we diagnose prostate cancer. It's changed outcomes for our patients. And it's a very important part of men's health as they reach age 50 and older.
I'd be curious how many times, say a month, that you get into a situation and you think, gosh, if only we would have caught this earlier. I mean, as you just pointed out, one of the most important things is we actually have a way to do that. It's sad that people aren't on top of their health in this way, because this one is a very predictable situation if you stay on top of it.
Absolutely. Look, let me tell you, every day I see 2 to 3 patients that come to my office that have had prostate problems for 10 to 15 years. Maybe they've been managed with medications by their primary care doctor or another doctor, and their symptoms have gotten so bad that they can't control their urine. They're leaking on themselves. They're afraid to leave the house. All of this is preventable. Not only is it preventable, but to that problem, that advanced problem, it can take even those symptoms to improve after surgery with medication. So my big point is ask for help early. One guy that we feel he's in the hospital with a catheter getting put in before you ask for some evaluation for your prostate.
Wow, that's such important advice. Why don't we do this? We've got less than about a minute left. If you had a message for men, what would you say to them if you had a chance just to tell them all? This is what you need to know right now.
Well, this is what I want the men in the Gulfport area to know. I am focused on bringing services to this community that were not here before I got here. We are doing robotic surgery at Singing River at Memorial Hospital. We are operating. We're doing surgery for prostate cancer, kidney cancer, reconstructive urology procedures. We are offering new BPH surgeries, aquablation. Haven't read about it, look it up. Aquablation, really, in my mind, is the next big trend in urology. It's the fastest growing surgery for men with enlarged prostate. And the reason is because you can get incredible relief from your urinary symptoms without having to compromise sexual function, without having to compromise the quality of your erections, your ability to ejaculate and have a typical orgasm. These are things that are unique to aquablation that many other procedures do not offer. And real access to aquablation this is based around a hospital's willingness to invest in product. These are robotic surgical tools like the Da Vinci robot we use for taking out kidney cancer. These are expensive pieces of equipment. Singing River has made a major investment into their community, and they want to be able to offer this therapy. And I am leading the charge on this. We're doing dozens of cases. We're having very good results. Patients are going home the same day. Why take pills for the next 20 years when I can send you home the same day, take your catheter out in 3 days, and fix your problem long term?
Well, listen, it's been a pleasure to spend some time with you, and keep up the great work. This has been Dr. William Hughes from Urology Associates, and this has been Singing River Health Talk. Have a great day, and we'll see you tomorrow.